So one of the issues that I'm asked about a lot in my practice with my male patients is issues around erections and erectile dysfunction. And they want to know if there's anything that can be done naturally for this. And absolutely, there's a lot of things we can do. To be honest, one of the things that will get men in the door almost quicker than anything is this issue. And so I use it as an opportunity because a lot of times it's hard to get men to come into the office. And so it's important to look at if there is something else kind of going on, because often men won't have gone to the doctor for a while. And this could be the first sign of something else deeper going on. So some issues around, heart disease, cardiovascular disease, nerve damage, diabetes. Those are all potential causes of erectile dysfunction. So it is something to investigate a little further than just, throwing a pill at it to get it to fix the problem. That being said, a lot of men don't have those issues as the cause of it, and there are some good things we can work with too. So just when I see someone coming in, I often want to work that up first. So I remember when I was first in practice, I had an older gentleman call me. He was in his mid upper 80s, call me and said it was an emergency. He had to get in that very day. And I said, we'll get him in. Sure, come on down. He wouldn't say what it was on the phone, but he said it was absolutely emergency. So he gets in the office, and after a little bit of shyness, he admitted that was the reason for coming in. And it's often an issue that isn't discussed in the doctor. And I often will ask everybody, all my male patients, if they're having any issues, just because it often is an issue that just won't come to the table if you're not asked about it. With this gentleman, I'd seen him before, so I knew some of his health history. He wasn't dealing with any issues like diabetes, heart disease, anything like that. So I recommended a couple things. He went home. Got a call first thing in the morning the next day. Let me know, big success last night, doc. Thanks for everything. I was just like, okay, a little too much information, but that's great. I'm happy for you very much. So thank you. So there are a lot of things we can do, and I've had success working with this. Obviously, there's medications now that we didn't have, 15 years ago, and the Viagras, the Levitra, Cialis, and this whole class of medications, and they do often work well for men. But you have to be taking them every, before each timing, get things right. And there is some heart disease potential risks. And there's all those warnings. If you have heart disease, talk to your doctor, and they can be problematic for people in that scenario. So a couple places I go, once we've ruled out that there is no underlying severe, cause for this, first would be obviously looking at the psychological component, because a lot of times this can be, there is some imbalance, some, issue going on that is contributing here. And so sometimes that's the place we need to discuss, have a conversation. And, is this happening with one partner? Is this happening all over the place? What's going on? Try to figure out the scenario. I mean, there can be physiological reasons, but often more common is a psychological reason. So that sometimes is the place we have to go. As far as things we can try, if it is, coming down to a physiological issue, probably my go-to medicine that I've had the most success with is something called L-arginine, which is one of the 20 amino acids that make up all our proteins in our body. Arginine actually works on a very similar pathway to the Viagras. So the Viagra works on nitric oxide, which is something that causes blood vessel dilation. And we need blood vessels to dilate to supply blood supply to get an erection. And so that's how those medications work. Well, where nitric oxide actually comes from is from arginine. Arginine contains an NO group as part of a nitrogen oxygen group. And so the body will cleave that nitric oxide group off of the arginine molecule and causes that it to be higher levels in the blood, and that's what triggers blood vessels to dilate. It's something called endothelial relaxation factor. So yeah, it works really well. Taking arginine, I've sometimes used a time release preparation to keep it around longer in the body, and that sometimes works better for some men. Sometimes an immediate one works better. Sometimes it just depends on the person. We're not all the same. We're not all monochromatic, where one thing works well for everybody. I know it's not the right word, but I like it. So anyway, using arginine can help dilate blood vessels. There's another couple herbs that we can use too. And then going back to the arginine real quick, I've had some success with men using it just as needed, kind of like a Viagra, using it at a larger dose, right, an hour before. Other men will just take it ongoing every day or twice a day, just to keep those levels around and get better dilation at any point they need. And it's a really safe amino acid to use for most people. And so it can be taken daily, and it actually has some heart disease benefits. Again, dilating blood vessels all over the body increases circulation to all places that could be needing circulation. So that's a good way to go. There's a couple other herbs I've used. Most of them have somewhat of a stimulating effect. So just some cautions on that. The one I've seen work well is yohimbe, which is a herb from, I believe, from Africa. And it can be used again right before, within an hour before. And then there's another one, red ginseng, which is coming from Asia. And those two herbs will cause, we know with the red ginseng, but I think with the yohimbe as well, there is some effect on that nitric oxide pathways as well. So they do work well. Caution though, if anyone has any heart disease or potential for that, it can be too stimulating. It can cause some like caffeine-like effects, kind of palpitations and things like that. So we use them in real small doses if you're going to try those, and talk with your doctor or your naturopathic doctor here if that's, if you have some issues with heart disease there as well. So those are probably my go-tos, the arginine and then some of these herbs. Then long-term, to get this issue working better, I think it comes down to, again, those basics of healthy living, which we talk about all the time, which is, exercise, sleeping well, eating better, clean foods, lots of fruits and vegetables, antioxidants in the body. All those things really come into play. If you're having erectile dysfunctions, it could be due to some imbalance in your body that could be corrected by, improving your overall basics of healthy living, which I feel like a broken record sometimes saying that, but it really comes down to it. Almost everything in the body improves when we start improving our overall health, eating better, sleeping better, being connected with a community, having, quiet time, relaxation, prayer, meditation, exercise, sleeping, all that. Again, these are just the core basics of health. And then lastly, I think the other piece is the low testosterone effect. So, that will cause erectile dysfunction as well. So that may be an avenue to investigate through either a blood test or a saliva panel where we look at those testosterone levels and correct them if needed. But often when men are dealing with erectile dysfunction and we run testosterone levels, it's not the case. And adding testosterone on top of an erectile dysfunction issue, just because you think that's going to help, doesn't always help either. So a lot of times there's other factors at play here. Blood circulation, there's potential issues with nerve health, and then there's all these psychological factors. It's a complicated process, though a lot of different levels needed to get the sexual process working optimally. So again, we have lots of tools. It's not always a one size fits all, but yeah, talk with us. We can figure something out that often will work and not make you dependent on having to take a medication. So thank you.